Good morning, Nicole. Thank you so much for joining me for a Corona conversation. If you could just introduce yourself, tell people what you do for a job and where you are today.
Sure. Thanks for having me, Adam. I have quite a few hats, but my main job is now as a consultant in the drug and alcohol sector. So I run a consultancy that works with mainly with government and treatment services to improve services. So we do evaluation and program design and policy type stuff and workforce development. And I'm also adjunct professor at the National Drug Research Institute at Curtin University. But I'm based in Melbourne, so that's where I currently am at the moment.
Okay, so on April the 1st, 2020, what is life like in Melbourne?
Well, a couple of days ago, we introduced stage 3 lockdown restrictions in Victoria. So that means no one's allowed to go out of the house except for really specific reasons. So to get supplies, go to the doctor, that kind of thing. Yeah. So it's quite restricted. If you go outside now, it's really deserted. There's not many people around, as there should be, and everyone's being really careful about physical distancing and keeping apart from each other.
Okay. And from your perspective, and I don't know if it's too early to tell, what's been the impact of COVID on supplies of drugs and alcohol to people with problems with those drugs? Has anything happened with that yet?
Well, it's hard to tell because we don't have that kind of up-to-date data, but the anecdotal evidence and a bit of logic, I guess, with the restrictions in ships coming in and flights coming in now that with the borders closed, it's likely that there's going to be a fairly big impact on precursor chemicals coming in, for example, to make methamphetamine in Australia, and also drugs that are imported whole into Australia, like methamphetamine, ice, heroin, those kinds of things. So I imagine we'll see some shifts in the drug market, which means people may not be able to get their drug of choice. They may be using other drugs that are potentially more dangerous that they can get their hands on locally, or they might be going into withdrawal, or accessing treatment, which will have kind of knock-on effects to the treatment services.
So, assuming that some people are going to find themselves in difficulty and might be thinking this is a really good time to get treatment, one would assume that drug and alcohol services would be essential services to keep open, in the same way that bottle shops seem to be essential and Australians can still buy alcohol. Is that the case?
No, that's one of the interesting things. In the early stages of shutting down services, bottle shops were on the list, actually literally on the list of things that were allowed to stay open as essential services. And a whole range of health services were. And now that list has been much more restricted. Bottle shops are still open, but it's not that clear that alcohol and drug services are essential services. So people are being asked to stay away if they don't need immediate treatment. A lot of the services are trying to do counselling online and get online by Zoom or whatever. But I think a lot of them are struggling. It's not our normal way of doing things, especially health, that kind of health service. People really like to be with people, and sometimes you really do just need to be in front of someone. So it is, I think it is really going to be quite difficult, and we need to, I guess, wait and see.
Is one likely response in Australia for people not being able to use heroin, either to access, methadone and buprenorphine, and I know that treatment services in Australia are trying to ramp that up. Is there going to be displacement to prescription medications, tramadols, morphine, pre-gabs? Is that a likely scenario or something you're hearing of?
You would have to think that there would be some displacement in some way. So if people can't get and it may be in either direction, I'm not really sure, but if people can't get illicit drugs because of the restrictions on imports and ships coming in, then they may switch to pharmaceutical drugs. And equally, we don't really know, but maybe if there's a limited supply of pharmaceutical drugs too, maybe people will start to use illicit drugs just to kind of quell some of their symptoms, who were, originally prescribed the pharmaceuticals. So it has the potential to shift use quite a bit, and the way people are using, and also then what happens in the treatment services as well.
So one of the things I know you have a particular expertise in is in crystal methamphetamine. I just want to think, with a reduction in precursors and with a reduction of crystal meth coming in from Burma and such places, what's going to happen to a large number of people who are dependent on crystal meth, who can't get hold of crystal meth, particularly where treatment services for people who use stimulants aren't as well developed and as effective than for people who use kind of heroin and other opiates? What's going to happen?
Yeah, well, I mean, I'm just guessing, but I imagine people will do one of a number of things. They may switch to other drugs that are more dangerous. So they may start using other stimulants that are synthetic stimulants. The new psychoactive type stimulants, which are much more dangerous, and we may see more overdoses and more harms. And they may increase kind of access to treatment services, and the treatment services are already overstretched before any of this happened. There's long waiting lists, and they're finding it hard to service everyone that needs to be serviced. So it's going to put additional pressure on that system.
And of course, as you said, those treatment services were already working beyond capacity before COVID appeared.
Yeah, that's right. Yeah.
So
yeah, it's certainly going to impact on those services fairly significantly. And I think, what's likely to happen too is that because we can't get the precursors in, and because we can't get the whole product imported in, there's going to be some kind of shift in local production that might have a bit of a time lag before we work out how to, ramp up production internally. So there will be, I imagine, some significant shortage of drugs for people who are dependent. And as you said, for people who use methamphetamine, there isn't a methadone equivalent that can kind of hold them during that time.
And even trying to ramp up home production in Australia is not that easy. You've got incredibly restrictive access to anything containing pseudoephedrine within chemists. It's not like someone's going to be able to go in, buy 30 packs of pseudoephedrine, go back and do a one-shot bottle mix, because it's really difficult to get hold of. And cocaine, you've got the most expensive coke in the world next to New Zealand, so people won't be displacing to that. There's, I don't suppose there's lots of, prescribed stimulant drugs available for diversion, whether it's Ritalin or lisdexamfetamine. There doesn't seem to be an obvious alternative if you like using stimulants.
No, I don't think there is. So, yeah.
So if I recall correctly, the last time there was a heroin drought in Australia, there was displacement from opiates to amphetamine, which I think was rather odd. Could you see people using stimulants switching to opiates?
I think, there's a couple of things about the heroin drought. That the spike in methamphetamine actually started before the heroin drought kind of kicked in, but it was definitely amplified by the reduction in availability of heroin. And you might imagine, generally, in my experience, people who prefer stimulants, and they don't kind of switch around. But when something's scarce, they may just to give them something to hold them. Yeah, so it's possible that there'll be displacement to other drugs. But you'd also expect heroin availability to be reduced as well, because that's largely imported too.
Yeah. So the one drug that we haven't spoken much about in actually any of these interviews, but I know the Australians love, is weed. And I can't imagine there'd be too much of a shortage of weed, which is largely homegrown. But my worry is, I guess, people smoking joints with tobacco, respiratory susceptibility to COVID. Is there any particular stuff going on with cannabis smokers, harm reduction advice, or are we just expecting everyone to go, well, there's no other drugs about, I'm just going to smoke weed?
Well, I imagine that there would be an increase in people smoking cannabis or using cannabis in multiple forms. And some of the states have just kind of relaxed the laws a little bit. So also there's more potential for people to use relatively safely, I guess. So there's likely to be a shift that way. And I think even without taking into account other illicit drugs, in times of stress, people just tend to use more alcohol and other drugs. And I imagine that, we're seeing a huge increase in people buying alcohol at the moment. I imagine that there'll be a little increase, at least, in people smoking cannabis as well, just out of kind of boredom or stress or just the usual things that drive occasional use. So even among people who aren't dependent, we're going to see an increase in harms and risk, I think, among just that kind of middle group that are occasional users.
Because people have more time. So yeah. I've asked this to everyone, and I want you to fast forward a year or so, when hopefully COVID is nothing but a Netflix series and life feels like it's a little bit back to normal. Do you think COVID-19 is going to lead to any lasting changes in Australian drug policy and the way drug treatment is delivered? And if so, what?
I can picture a scenario, fast forward, in which services have had to think very carefully about how they respond in this kind of crisis. And we've just recently had a few years of significant problems with methamphetamine, and the services have had to and government have had to really think about how to respond to new trends. And this is kind of, in a way, another one of those trends potentially. But what I would hope to see, in like an optimistic kind of way, I suppose, is that services would think a little bit more creatively. They're going to have to think a bit more creatively about how they provide treatment, and how they provide it more flexibly, how they might offer online kind of consultations and telehealth on an ongoing basis for a whole group of people, which is really critical. Australia is populated around the edges in the capital cities, and the regional areas have a real dearth of services. And if we can set up services better to provide telehealth, we could potentially access a whole new group of people and a whole broader range of people, and also be more efficient with it as well. And it might actually kind of lighten up the waiting lists and, have some knock-on effects as well. So, just in a kind of ideal world, I hope that is the kind of knock-on effect that it's going to have.
How about on drug policy and criminalisation of people who use drugs? What do you think is going to happen?
Yeah, that's an interesting question. And we were already kind of moving towards more liberal drug policies compared to previous years. So you probably know the ACT has this year, just a couple of months ago, legalised the personal use and growing cannabis. And only a month or two ago, in response to the ICE inquiry, the Special Commission in New South Wales, the New South Wales state government rejected nearly every recommendation, but they did say that they would consider decriminalisation. And there's a lot more states have embedded not decriminalisation, but kind of de facto decriminalisation through diversion, through mandatory diversion. So we were already moving in that direction. So it's possible that we may see another shift around that.
Okay. So look, thank you so much, Nicole. Is there anything else that you'd like to say as a takeaway message, or something you think people need to be aware of what the impact has been where you live and your home?
Just in general, I think that the impact of quite strong measures which are required for people's health, we might have, I think, forgotten about the social and mental health impacts of those things, and I can see that that's kind of creeping into the narrative just in the last couple of days. But, these are the kinds of things that shift people's drug use as well when they're feeling stressed or anxious or depressed or lonely. Those kind of things are also drivers of drug use. And if we don't make sure that those things are addressed as well, and that people's mental health and their social interactions are addressed, then we are going to have even greater problems with drug use and mental health and all those things. So I really feel like it's time for us to, in parallel with the public health issues, to really start thinking seriously about people's mental health as well, including their use of drugs.
Yeah, and it's, again, they're lessons that are really obvious, but you can't ever think about managing drugs and alcohol without considering mental health, social health, and physical health and well-being. So maybe COVID is a thing that helps us bring that together.
Yeah.
All right.
Yeah.
Thank you so much. Really appreciate your time. And stay safe until we speak again.
You too. Thanks, Adam.
Nicole. Take care.
Bye.
Cheers. Bye.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah. No longer focused on yesterday, and I don't care, the rest will say whatever they want, what's left